I'm here at the 5th annual Hilltop Public Health Conference, where students are hoping to discuss, with the help of health experts, about disaster preparedness and how it's changing with the effects of an evolving climate. I spoke to students who planned this event about why disaster preparedness and management is so prevalent right now, especially in the realm of public health.
GW senior Sarah Lawrence saw the public health issues facing women in Uganda firsthand on a trip to the country last year. She selected the interns who traveled with her to learn about a community with fewer resources but a rich culture. Sarah Lawrence said her role as campaign's co-director for GW GlobeMed has shown her that there is always room for improvement when working with a global nonprofit organization, even one you haven't met in person yet.
I didn't really meet with Set Her Free until we went this summer, but I've been working with them for over a year. And it's important to have those conversations and to open up dialogue where you're learning how you can support each other when you're coming from different cultures, because that dialogue is needed to have these important international conversations, but they're not going to work out if you're not acknowledging the cultural and other differences that exist.
With the help of the nonprofit organization Set Her Free, Lawrence has helped create an online database for Ugandan women to speed up their job search when natural disasters set them back. The organization Set Her Free is based in Uganda and works to empower young women and girls to get an education, providing shelter and reintegration services. They can then live more independent lives and find resilience when disasters strike. GlobeMed at GW is a chapter for the larger global health organization that partners with nonprofits in third world countries. The organization works with Robina Muganzi, the coordinator who started Set Her Free. What started as 6 girls in the program has expanded to a whole community supporting women and girls in Uganda who had nowhere to turn to either financially or emotionally. Dana Lee Harrington, a global health major at GW, was one of the 3 students chosen to go on last year's trip to Uganda. She said it was an opportunity that she never thought she would be able to experience during her life or time at GW.
It was genuinely a once-in-a-lifetime opportunity to be able to meet these staff members and see all the hard work that they're doing and how our partnership is benefiting them, but also how their partnership is benefiting us. Was an amazing experience.
Through recent fundraising events, GlobeMed at GW reached their annual goal of $10,000, which supports Set Her Free and their efforts to help Ugandan women. Hannah Vick, who spoke at the GlobeMed conference, said it's important that when organizations in the U.S. work with local nonprofits in other countries, that they are focusing on building resilience in communities.
It doesn't matter when the incident happens or how often the incident happens, your incident response, either public health or disaster or whatever it is going to be different. And so you, in these professions, need to embrace that change.
She said she wants students at the conference to stay hopeful about making a difference in communities going forward and look toward the positives rather than the problems that occur in a local community or country.
I think so often we really focus on the problems, and we need to talk about the problems and all of the challenges, but there's a lot of energy in us coming together and talking about some of the solutions, talking about what each other is doing, and how it is that we can contribute to something much, much bigger than ourselves.
GlobeMed students look ahead to future ways of helping women and girls in Uganda with their partner organization Set Her Free, where they help prepare for natural disasters in vulnerable communities. Students are preparing for the next trip, a months-long trip in Uganda, where they better prepare for natural disasters waiting to happen. This is Shay Carlberg from Washington, D.C., George Washington University.